Professor Robin Taylor lives in Edinburgh in Scotland. After 25 years in New Zealand as a consultant respiratory physician, he now works in Scottish hospitals. He is devoted to improving end-of-life care in acute medical and surgical wards. He leads seminars on death and dying for both lay and professional audiences.
Attitudes to death and dying have a very strong cultural element. Whereas the Victorians mourned death, you would say, extravagantly, that all began to change at the beginning of the 20th century with the mass mortality and the mass bereavement of the First World War. We honour those who were sacrificed at that time in annual ceremonies, but as for death and dying, we don't discuss it. It's beyond discussing. It became beyond discussing. For some, it became too much even to think about. That's our legacy. But like leaves in the autumn, we will all eventually die. It's maybe uncertain as to whether the leaves will fall in October or perhaps later in November, but fall they will. There's no uncertainty about death. By late December, all the trees are bare. So is this patient in the last stages of life? Was he in the last stages of life before he was admitted to the ICU? In the 60s and 70s, scientific advances in modern medicine meant that a death-denying culture turned into a death-defying culture. We try to fix it for all of the people all of the time. And if death happens, we see it as a failure. It's perhaps even someone's fault. Rarely are we prepared for it because we are so preoccupied with trying to avoid it. What is this lady thinking? It's her 4th hospital admission in a year. She's frail. She's breathless. Her heart isn't working. Yet no one has told her the truth that she knows to be true. I'm approaching the end of my life. What does she need? More pills? A CT scan? Another operation? Perhaps, but perhaps not. How about truthfulness about her future and hope that is realistic? How about compassion and common sense? How about consolation as she wrestles with her fears and her sense of being terribly alone?
In this presentation, Professor Robin Taylor explores some of the challenges that thousands of people face every year. Not just those who are at the end of life, but also those who care for them and support them. The same challenges are faced by doctors and nurses who are locked into the fix-it system of healthcare, who experience moral distress when medical interventions are excessive and palliative treatments are neglected. We need to overcome this taboo. One day it will be someone you love. One day it will be you. King Solomon said, "Death is the destiny of everyone. The living should take this to heart."